Hi, my name is Lizzie Polina. I did my immersion experience project on the book Push Girl by Chelsea Hill and Jessica Love. What is Push Girl about? 17-year-old Kara lived a normal high school life. She was a dancer, had a boyfriend, and a good social life. One night after leaving a party with her friends, she got into a car crash with a drunk driver. Unfortunately, the drunk driver died instantly while she was left in a coma for 2 weeks. After spending 2 weeks in the coma, she woke up in a hospital bed, scared and confused. Her doctor and her parents had described that the car accident she was in was very bad and that she had paralysis from the waist down. Her life as a teenager would never be the same again. She struggled emotionally and physically after her accident. One quote from the book that I thought was influential was, "I'm a dancer," I told him, as if bringing this fact to his attention would make him realize what horrible mistake this whole thing was. It's not like I was just some random teenager who lost the use of her legs. I needed to be able to dance. I needed to be able to dance like I needed to be able to breathe. On page 53. What is paraplegia? Paraplegia is the paralysis of the lower body, usually caused by spinal injury or disease. 1 in 50 people are living with some type of paralysis. The cause is damage to the brain, spinal cord, or both. Most common causes of paraplegia are car and motorcycle accidents, falls, violence, sports, diseases. Some signs include loss of movement, loss of sensation in the lower area of the body, a tingling feeling in the lower half of the body, problems breathing or coughing, etc. Can paralysis be cured? There is no cure to paralysis. In some cases, feeling or control may return with time and treatment. However, each patient is differently and may have a different experience. Some rehabilitation services are physical therapy, occupational therapy, mobility aids, supportive devices, assistive technology, etc. Can language be impaired? Yes. However, in the book Push Girl, Kara's language was not impaired, but it can be. Spinal cord or brain injury may impact their speech. Language comes from the left side of the brain, the Broca's area, so if that side of the brain is damaged, word finding difficulty may happen. Poor sentence formulation may occur. They may suffer with pragmatic difficulties such as not being able to understand sarcasm or jokes as easily. They may suffer from a TBI depending on the accident. Some TBI symptoms may include speech and language disorders such as dysarthria, apraxia, or other disorders. What I learned. Not everyone who is paraplegic may suffer from a language disorder, but it is possible, depending on where the injury occurred. Having a disability can be mentally exhausting. Throughout the book, Kara feels very tired and depressed from trying to emotionally battle this new disorder she has. There are 2 types of paralysis. There is complete and incomplete paralysis. Complete paralysis is all feeling is lost below the spinal cord, and incomplete paralysis is that there's some feeling below the spinal cord. Kara had complete paralysis. It is possible to gain back feeling where paralysis occurred with some rehabilitation treatments, but every patient is different. I learned that it is important to be a cautious driver, to look out for yourself and also others. The picture to the right is showing different types of paralysis. So a few ones are hemiplegia, that affects half your body, paraplegia, that affects your lower half, quadriplegia affects any part of the body, and monoplegia might just be one limb. What information will I take into my future career? I will take into my future career to be mindful to treat all patients with equal respect. I will be mindful that patients who have gotten into accidents may or may not suffer from a language disorder. An accident may be a reason why an individual has a language disorder, or it may not be. To be understanding during therapy with all patients, as you never know what is going on with their life. They may be struggling emotionally or physically or both, and to be sympathetic and understanding to everyone is very important as a speech-language pathologist. Thank you for listening to my presentation.